I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I appreciate very much having the opportunity to have this chat with you and discuss very important things. I think very important. They are very important to me because I know that if you follow, if you try to understand, if you try to actually get the hang of it and learn more about it and enjoy what you're learning and so on, you can do wonderful things for you and for everybody around you. I have been talking about health and disease for many years. In the old times, of course, we had seminars, we went to towns and cities, and we talked to people one to one. Today, I don't know if it's better or worse. Probably it has both. Some of the things are a lot better because you can reach you in wherever you are, whatever time you want to listen to this show. The bad part is we don't get to talk to each other. But I'm going to give you opportunity to do that. Because if you read under my communication, you're going to find ways to connect with me and to chat with me or to ask questions directly. And I'll be very happy to talk to you. I'll be very happy to go back to you. And I've been talking in some of the programs about cancer. Why cancer? Number one, because it's one of the things that I have been working with for the last 50 years. I have over 50 years as a doctor, and I have always been very close to cancer, even though I'm not an oncologist. But I started as a nuclear physician, so I was to me was a very important part of my job to find out cancers, and the earlier the better. And then I started working on integrative alternative medicine. And then I started looking at things that to me nobody else was looking at. And ever since I went through medical school, and after finishing medical school, I always felt there was something that we were missing. We were talking more and more about drugs, more and more about tests, more and more about imaging. And even though we have made progress with those, I found that we have a number of conditions that are growing in frequency, that are affecting younger and younger people, that produce a lot of suffering and expense and pain for which we didn't have an answer. And cancer has to be the pinnacle of them all. Because I have always thought, what would I feel if I'm sitting across a desk and somebody tells me, after all this we have done, you have cancer? I'm sure I'd be terrified. I think that's the word. I think my whole world would go upside down. All my plans have to be canceled. This is not something that you can leave for next month or next year. This is something you have to act upon immediately. And everything around you is going to turn upside down. Your plans, your expenses, your daily life, your work. You cannot go to work because you have an MRI, or you cannot go to work because you're going to have surgery, and God knows when you're going to be able to go back to work. Your whole life has to be upside down. So cancer worries me a lot. And it worries me a lot also because as many of the degenerative diseases that we see nowadays, it's growing. And we see more and more people. Not only we see more people, we see more younger people affected by cancer. So all you have to do is look around. And if you are as old as I am, you can think of who you knew when you were a youngster with cancer. There were very few people, and normally they were old people. We always thought cancer was an old person's disease. But today, we see more and more young people being affected. And I remember one day I was having a very casual talk with a doctor that I respect a lot. She's a very good physician. She works a lot with cancer. And very casually, I just said, what do you think? Why are we getting so many cancers? Why it seems that we have more and more people with cancer? And her answer was very simple. It is so frequent that it has to be something we do every day. It's not that you did something today that's going to produce a cancer. She was right. It has to do something that we do every day. And probably that we do more and more every day. That's why we see more cancer. And probably something that younger people do every day, because we're seeing cancer in younger people. So if you follow this thread, you're going to see that it just has some logic. So I thought, yeah, that could be it. And the other part that troubled me is, what is cancer anyway? Because we can talk about a lot of diseases and be very specific. And I'm going to use a very simple example because we are all familiar with it right now. I'm going to talk about COVID-19. COVID-19 was a word that we didn't even know 4 years ago. All of a sudden we have this problem, people start dying, people start having all this syndrome, going to the hospital, to the emergency room, to the respirator, and died. That was 4 years ago. Today, we have pictures of the agent that produces it. It's like when you have a robbery in any place, and the police shows you the videos that shows how the intruder broke the window and came into the thing and opened the safety box and took your money out. So now you can follow him. Not only that, but the videos outside have the license plate of the intruder. You can do something about that. Same with COVID. You knew what caused it. You went to the electronic microscope and all sorts of testing, and then they said, this is the cause. And we saw pictures. They were on TV. They were on the news. Not only that, but just a year and a half later, they tell you you have a vaccine. Now you can get a vaccine and avoid it, etc. Whereas the subject is controversial or not, we had a lot of things to act upon COVID in a total time of probably 40 years. Not even close to what we know and do about cancer. I mean, Richard Nixon, he offered a long time ago that he was going to do a 10-year huge effort to defeat cancer. Well, Richard Nixon is long gone, and I don't see the end of it. I hardly see the end of it. So, thinking about my friend's comment that it has to do something that we do every day that can give me the cancer, like, begins to make more and more sense. Not only that, but I don't have to tell you, you know very well, why is it that I can have a cancer in the lung, or in the brain, or in the stomach, or in the colon, or in my bone? What's the link? Why the cancer can be in different organs and in many ways behave the same way, but in many ways behave in a different way? Then again, you think this is something that has to do with total physiology and anatomy of our body. because we can actually develop cancer for what I can see anywhere in the body. So you say, okay, then this has to be not a local problem. This probably has to do with something we do every day that affects every single part of our body. And if we start thinking in that direction, then we start thinking, I have to begin to understand this. But let me tell you where I'm trying to get to. Where I'm trying to get to is I'm trying to guide you into thinking and looking around you and say, where is the offender? Where is the thief? Where is the outlaw that's going to get into my body and damage my body? In other words, we have to start becoming more vigilant. Well, if it's something I do every day, if it's very close to me, if it's very probably even inside me, I have to find out what it might be to prevent it. And if I begin to understand that, if I begin to think in that direction, I might be able to avoid it. And let me tell you once for all, yes, cancer is preventable. You do not have to get cancer. The Center for Disease Control and Prevention, which lately added that word to the name of the institution, Center for Disease Control and Prevention in Atlanta, Georgia, one of the most important medical institutions in the USA, tells me that yes, cancer is preventable. We can avoid it if we just play our cards right. So, with all that information, I want to see where that cancer might be coming from, because if I start to identify all those conditions and reasons, I'm going to be able to avoid it or beat it if I have already been diagnosed with cancer. And no, this is not, I'm not going to talk about specific drug, I'm not going to talk about specific thing, I'm going to talk about our daily life. My friend is right. It has to do with something we do every day. Please stay with me. To me, this is a very important message. I'll be right back. My friends, you are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I'm having a very important conversation for me. I hope it is equally interesting to you, because I'm talking about cancer. And I'm talking about things like we don't fully understand this disease. There are many things that we do not understand. And even though we can get an overwhelming amount of data about cancer, cancer behavior, cancer treatments, cancer this, cancer the other, I could fill 10 libraries with all that information. I still don't know what it is. It's a very poorly understood disease. And I was using the example of COVID. With COVID, yes, you have this thing and people started dying and we didn't know what it is, but all of a sudden they come out and they say, hey, we have the picture. This is the virus. And we call it coronavirus because it has a crown. And they start giving you all this information, and later on they say we have a vaccine. Independently of what you think about vaccines, they were able to produce a vaccine against this thing in a total time of less than 4 years. How long have you been fighting with cancer? How long we as humans have been facing cancer? Ever since the beginning of times. Egyptians talked about cancer and tumors, as they were called. Tumor, because the Greek word for a growth or for a lump is tumor. So we started using the lump as equal to a cancer. And so we say we have a tumor, and just to make it with a little bit more emphasis, we might say a malignant tumor. And malignancy, which is a word that we use very frequently too, refers not to the diagnosis. You have a cancer, all right. You have a lung cancer, all right. You have a lump in your breast, all right. You have all this, all right. What does the word malignancy mean? A malignancy comes from the word malus in Latin, comes from Greek also, and it means evil. So when you talk about malignancy, you're talking about the behavior of the tumor, not what it is. It might be small, big, spread, whatever. Malignancy is how evil it is in working against the rest of our body. Cancers, once they arise, they're going to do anything they can to kidnap all your functions, all your energy, all your everything. That's why you see people with cancer, you can see how they diminish in size, diminish in energy, diminish in everything, but the tumor gets stronger and stronger because of that malignant behavior. They're going to kidnap everything, every resource your body has. Well, ever since humans exist, we learned about a very important phenomenon, and that is inflammation. I mean, you can think that even before the times of anything, if you have a caveman that went down through a cliff and survived, you can believe that he had lumps and pains and fractures and these things, and you could see, I mean, you didn't have to be a doctor, you didn't need an x-ray, you could see that the area got swollen, that the area got painful, that the area got etc., etc. And that started developing the cardinal points of inflammation. The symptoms we see, we don't need a doctor, we don't need an x-ray, we don't need a laboratory, we don't need anything. You have 4 cardinal points. And the first one is a lump. Why a lump? Because every time you hit something, every time you hurt something, it swells. It increases in volume. That's inflammation. Second, it turns red. It turns red because there's an increased blood flow. The first thing the body does, and it is in a matter of seconds, literally seconds, the blood vessels open up and let a lot of blood go to the afflicted site. So the site gets swollen because a lot of volume, and they get red because this volume is in big part blood. And the next thing is heat. Heat because with all that volume of blood flow going through the area becomes hot. If you use a hammer on your finger, you're going to see that it swells, that gets red, and gets hot because of the increased blood flow. And the last one, I don't have to tell you, we all have left a finger enclosing the car door, and the last one is pain. So if you have those 4 things, you have inflammation. Inflammation, a good friend of mine also said, inflammation is always synonymous with pain. If you have inflammation, you have pain. When you move and you say, oh my God, my back aches, that's inflammation. When you try to do something and then your arms ache, that's inflammation. Your knees on a cold day, all that is inflammation. So make no mistake, pain is inflammation. The other one is increased volume. So any area of your body that's swollen, it's inflamed. And inflammation is a very important defense mechanism of the body. Actually, if we didn't have inflammation as a tool, we would not survive. Because we all have fallen, because we all have hurt, because we all have damaged somehow our body, because we all have been subjected to irritants. It's not necessarily that we hurt with something. You can use a simplest example of them all. Have you ever gone to a swimming pool and stayed longer than what you should, and then you can hardly touch your skin because it's hot, it's red, and it's very painful? That's inflammation from solar radiation. So radiation can bring that. Chemicals. You're cleaning your house with some of these terrible things we use today to cleanse, and it goes on your hands, and then it gets red and so forth. That's inflammation. You get a little thing, you're doing your garden, and you get one of these little spikes from your rose garden, and then it hurts. But then it gets inflamed, because all that is inflammation. So it is a non-specific response to whatever damage the body gets. And its job is to see that we can repair the area very fast. That's why it acts within seconds. But one of the tools to do that is by using special chemical substances called cytokines that produce a lot of side effects. Like if you damage a cell, you don't let it die. You help it to survive, because you're going to need it at least for some time until you get a replacement. If a lot of non-natural things happen. You need white blood cells to attack a potential microbe. Well, then you open up all the channels for white blood cells to transit from the blood flow to the tissue. That's why it gets so swollen. You're getting a lot of fluid, a lot of cells going into that tissue. That changes the permeability of the blood vessels. That changes the adhesion capacity of every cell. That changes a lot of things. But the problem is that a lot of those things are also present in a cancer. So my question is, what do I have to do? All you have to do is watch inflammation. Be careful, be vigilant. Let's say I left my finger as I closed the car's door. It's going to hurt, it's going to be very bad, etc. But it's going to go away. Once the repair is done, it is going to go away. A month later, you don't even remember. The idea that you hit your finger, oh yeah, I had forgotten about it. It's gone. But if that inflammation persists for any reason, then you have to be careful. And one of the problems that we have in today's lifestyle and environment, once again, I'm going to go my friend's statement, has to do something we do every day. One of the things that we see more and more every day is a continuous state of inflammation. Continuous. If I wanted to do testing, I'm sure I would find some sort of inflammation just about in everybody. Why is that? Because we're giving the body substances that the body either doesn't need or doesn't need that much. One of the best examples is sugar. Did you know that some toddlers in the United States might be eating their own weight in sugar every year? We use sugar for everything. And the amount of refined sugar that we're giving the body is difficult for the body to handle. So it produces substances in the blood that act and produce a reaction from the body, which is an inflammatory reaction. So many people have an underlying inflammatory condition because what we eat, because of lack of exercise, because the type of lifestyles we have, because the oils we eat, and because we do not eat the things that should be helping us. With all that in mind, can we make changes? Sure we can. And stay with me because we're going to talk about that. Don't get cancer. You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I'm very excited, I'm very happy to have the opportunity to talk about the connection, the link between cancer and inflammation. This is very important because on one hand, I'm dealing with a terrible disease, which is cancer. A disease that I do not fully understand, for which I don't have a clear therapy, where the word cure is almost non-existent, and that's going to produce a lot of suffering and expenses, and it's going to put my whole life upside down. Everything is going to be postponed, everything is going to be cancelled, and not only my life, it's everybody that's around me. Because when you have a person with cancer, the whole family is sick. The whole family has to go to the doctor. You go to work and you say, my husband, my wife, my son, my whoever has cancer. Life is different for you. So that's what I have on one hand. On the other hand, I'm following the track of something we do every day that probably brings about cancer. But the important thing about this is that I can manage it. I can do something about it. With cancer, not much. With this, yes. Cancer, I don't fully understand. This, yes, I can make changes. And that is inflammation. We said that inflammation is a mechanism of defense without which humans would not survive. That's how important it is. The problem is that in our daily lifestyle, in our modern lifestyle, and it's very important to underline this modern time, today. It's very important to underline. And you say, how can you say cancer has always been around us? Yes, but not in the numbers we see it today. Any one of you that's my age, if you're my age as your dad, your granddad, and say, Dad, did you know a lot of people with cancer when you were young? They were going to tell you no. How old were they? They were old people. And today we see a child with leukemia, a lady with breast cancer, 35 years old, a man with sarcoma, 45 years old. That's not true to be. And then I know this person, the following person. We see more and more cancer. And on a casual conversation, when I wonder, I wasn't really expecting an answer, I just was kind of speaking out an idea like, why are we getting more cancer? And in younger people. A doctor friend of mine, a very good physician, answered it has to do with something we do every day. Because that's how prevalent cancer is becoming. Cancer is hitting just about everybody. I'm going to give you another hint. It is more prevalent in civilized, industrialized societies as Americas versus than what it is, let's say, in Central Africa or in the jungles of South America. So, what's going on? What's the difference? And the difference might be what we do every day. And we find that connection with inflammation. Why? Because even though inflammation saves my life, if I find a way to fuel inflammation for no purpose whatsoever, in other words, you don't have a fracture, you don't have an irritant, you don't have any problem whatsoever, but you're producing substances that trigger chronic inflammation, and that's the key, chronic inflammation. Even if it's not very active, it creates the environment where cancer can develop and progress. Because inflammatory markers can block, for example, apoptosis, which is a normal mechanism by which we destroy faulty cells. If we cannot destroy faulty cells, that means that faulty cells are going to prevail. Inflammation can trigger mutation. And it's not a mystery to anyone to know that a cancer cell is a mutated cell. So if I create the environment for mutations to happen, I'm increasing the chances of getting cancer. So you see, inflammation can be connected to cancer. And some cancers are actually indeed directly connected, that we know of, to, for example, some chemicals. Cigarette smoking is one of them. Okay? Asbestos. You can develop mesothelioma just by being exposed to asbestos. And what about infectious agents that produce inflammation? Well, we have hepatitis B and C. Those can produce liver cancer. What about Helicobacter pylori, which is another bacteria in the stomach? That can produce cancer of the stomach. So you follow? What about inflammatory damage by irradiation? What about melanoma and sunlight exposure? So inflammation, yes, it can be connected in many, many cases to cancer. So what I have to do is fight off inflammation and fight off chronic inflammation. And then I learned that chronic inflammation is triggered by several substances. One of the worst offenders is refined sugar. We have too much sugar. So when you take this overwhelming amount of sugar, what happens is that sugars has to be composed with a protein and go to the blood flow and creates a substance that triggers chronic inflammation. Very mild. You don't notice it, which is worse because you cannot fight it. But it's there and can produce a lot of terrible diseases. Alzheimer's would be probably one of them, but also cancer. We eat bad oils, really harmful oils. Remember, I have always said, just have the oils that God put in your hand. What's that? Lard. That is olive oil. That's real butter. Those you can do. But don't go and buy vegetable oil that comes from corn. I have never seen any oils in corn. So you go to YouTube and you say, how do they get oil out of corn? And then they tell you, well, because they extract it with what? With chemicals. That's not natural. That's not the best way to honor your body. That's not what the Bible says. So I want to eat natural foods that were given by God. I have a man, 50 years old. His father develops prostate cancer. And he says, I'm going to check myself, because if my father has prostate cancer, I might have it. Not necessarily so, but he did the test anyway. And he found out that he had a little elevation in PSA. So he didn't take no for an answer, so he went to Berkeley, he went to National Institutes of Health, he searched for every possible way to make sure he did not have prostate cancer. And one of the things they found were tiny little areas in the prostate that were suspicious. And of course the doctor said, don't do anything, come back in 6 months and we check it. Again, he didn't take no for an answer, so he came to us. And when he came to us, I said, listen, what you have to do is you have to do a very well done anti-inflammatory strategy. And that begins with reducing all these oils. Get them off your life. Start doing this, start doing that. You start eating a lot more fresh, local vegetables and so on. You know the rules. You're talking of something like the Mediterranean diet. And he started doing it. In the process, he lost like 10 pounds. He looked fantastic. He felt fantastic. And he was doing his lifestyle changes. He started running and jogging. He was in his 50s. So he looked fantastically well. When he went back to all these major institutions, they said, those things are gone. And your PSA is normal. What he did is he went on an anti-inflammatory protocol that he followed strictly, and he got his paid. Also, we are eliminating from our diet omega-3 fatty acids, which are anti-inflammatory, naturally anti-inflammatory. And what are those? Those are fish oils. So you have to introduce fish to your diet 2 to 3 times a week. A good one is raw nuts. But we don't eat raw nuts anymore. Nobody has a nutcracker anymore. We buy them in a can, roasted. Fatty acids are gone. So if you begin to see beyond the supermarket ads, you're going to begin treating your body in a different way. Every time you drop sugar, every time you drop a cigarette, every time you prefer water versus soda pop, every time you make any of these little changes, you might be killing or destroying a cancer cell. You have to have a much better caloric balance. How much we do, how much I eat. If I don't do too much, I'm going to eat less. It happened to me in the pandemic. People were gaining weight. Why are you gaining weight? Because I cannot go to the gym. Well, then don't eat that much. It doesn't take too much science or a computer to figure out that if I do less physical activity, I should eat less. So just be conscientious about who you are and how much you want to take care of your body, how much you want to BioCare your body. Stay with me, please. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I have a blog, I have a chat, I have a discussion with you that, first of all, let me thank you for paying attention to it, for going through the whole program, because I think it's important information. And I would ask you to follow me, to go to the social media of your choice, to learn more, to educate yourself. There are many resources on the web that you can go to learn more. And if you have any questions, please feel free. my any way to access me directly is on the screen, so you will be able to talk to me at any time. I've been talking about the connection between inflammation and cancer. And this is a question that I have had in my mind for many years. Because I have seen more and more people with cancer. I have seen younger and younger people with cancer. I have seen children, adolescents, young adults, young people, not only with cancer, but dying of cancer. And let me tell you something. I always hate it. I hate cancer. Because this is something I have said all my professional life. Even in the best cases, you suffer a lot. The patient, everyone around him, everyone around her, and we, the doctors, the nurses, the health professionals, we suffer as well. So I always wonder, why are we seeing more and more cancer? And you have to say something we all are doing wrong. Or things that we're not doing well. Because in other countries, the cancer's prevalence might not be the same. Some places of the world have very low incidence of cancer. But the industrialized societies, as America, have a lot and have more and more. And the question is, where is the connection of where is the culprit? And after analyzing a lot of information, we seem to concur to the fact that it is chronic inflammation, the foundation for this thing. Why chronic inflammation? Because chronic inflammation is being triggered by our lifestyle. So this is a universal phenomenon. And we all are creating the conditions to help these diseases to develop, not only cancer, but also diabetes, high blood pressure, heart disease. Those are diseases that are killing Americans today. Not even COVID, not infections, nothing. It is these chronic degenerative diseases, inflammatory diseases that are killing us today. And the important part, the dire message, is that we don't have to go through it, that these conditions are preventable. But what we have to do is sit down and reassess all our lifestyle. Many very simple modalities are very helpful. I told you the example of this man who, just by cutting out oils, improved to the level that cancer was undetectable. Well, he actually never developed a tumor, but he was able to erase any trace of what seemed to be the origin of a tumor. So yes, this is possible. So we can make all those changes and profit in the best possible way, with a lot of health and enjoyment. I tell you, and I have said it before, every time you choose to eat well, local, good quality, fiber, vitamins, fish, raw nuts, etc., every time you do that, you're helping your body to live longer and healthier. So drop the sugar, drop the soda pop, drop the things that you know are bad for you. Don't buy them. That's the worst part. You take your hard-earned money and spend it on something that's going to be harmful. In other words, you're working against you. You're using your money to attack yourself. Don't do it. We have to act in a different way. BioCare, throughout its history, has been working with a lot of people around the world, or in the United States with different people, different ages. And you know what? Every time I see a therapy plan, like for example, the enzyme therapy in Germany, which is like back from the 1930s, the diet programs, the REAMS program for evaluation, for example, of pH in the blood, etc. All of them have an anti-inflammatory strategy at the bottom. All of them. So, if you have cancer, what you have to do is you have to go to a center that has all these things in mind. Because yes, your surgery might be necessary, your therapy might be necessary, your chemo might be necessary, yes, but you need to do a lot more. And a lot more you can do. We act many times locally, but we need to have a global approach. Your whole body has to participate if you want to be successful. You have to produce the environment that's not good for a cancer cell, and that is an anti-inflammatory environment. I don't have to tell you, and I don't have to prove it. I think we all know it. People that live healthy live longer, because people that live healthy, that exercise, that eat a reasonable amount, that don't eat junk food, etc., that don't drink soda pop, that don't smoke, they don't drink. People that have healthy lives live longer because they, in fact, have an anti-inflammatory lifestyle. As simple as that. Even, for example, it has been observed that people that take anti-inflammatories like aspirin or non-steroid anti-inflammatories for whatever reason, they have a lower frequency of cancer. Do you need any more proof? Every time you act against inflammation, your chances of developing cancer will go down. Every time you have an anti-inflammatory activity, your chances of defeating cancer are going to go up. Now, when you come to BioCare, yes, we're going to do the blood test, we're going to do the imaging, we're going to do a PET scan, we're going to talk about your cancer, but every time we're going to have in our heads the global needs of your body, the anti-inflammatory strategies, in how we're going to feed you, how we're going to nourish you, what's in your food, if you have enough omega-3 fatty acids, which, by the way, are very anti-inflammatory. So eating fish is good for you. Simple as that. Drinking water is anti-inflammatory. See, but not soda. Soda has, carbonic acid, and it has sugar. You don't need that. You need plain water. That's what God gave you to drink. So every time you do that, you're doing something which is anti-inflammatory. Every time you move, our muscles consume a lot of the inflammatory markers. They destroy them. You know what else they do? They lower sugar levels. So if you're diabetic, if you have cancer, you have to move, you have to exercise. I'm not saying, you might say, I have a cancer, doctor, I cannot go and jog. No, but you can move. Even if you're sitting down, you can have passive movements. You can put a pulley and a cord and lift things and ask your family to help you. You can put a jog on the other side and just pull it up and down. And that's going to help you, because that's going to be using inflammatory markers and it's going to make you feel better. And you say, doctor, it's been kind of complex to follow all this. Yeah, I know it might be. If you're not if you're beginning with to face a problem like this, it might look like a confusing or lost. But that's why I'm here. That's why I'm talking to you. Because you can go to BioCare Hospital, you can go to Rodrigo Rodriguez, you can go to any social media of your choice and search for me and get the message and contact me directly. I'll be very happy. I have done it with a lot of people. And that costs you nothing. But it's going to set you on the path to begin your anti-inflammatory protocol at home, for yourself, for your family. Because you do not want people to get cancer. You want to change the way you live. You want to use your money and your retirement to travel or to enjoy life, not to pay doctors and treatments and be in pain and have everybody else suffering. Because those that have been there know I'm telling you the truth. The cancer patient suffers a lot, but so does the caretaker. So you don't want to do this to you or to anybody around you. So you can start your anti-inflammatory protocol today. Start making the changes. Review what you do, what you eat, and so on. And once again, you check with Dr. Rodriguez and you say, this is what I'm doing, what else can I do? And you're going to see that it is inexpensive, it's fun, it's lovable to do these things, and the most important thing, it's going to give you a longer survival, a better quality of life, better health, and health is wellness, and wellness is enjoyment. Enjoy your life until we meet again. Thank you for listening.